begin. Okay, so our today's session is about to begin. So, okay. So today's sessions consist of two parts. In the first part, we will have the participants' presentation. So in total, 9 representatives from the 9 universities, health institutions, and hospitals will provide their presentations about this program. So now, student time limitation, every participant has only 10 minutes for the presentations. So just let's welcome to the first presentation from the Dr. Maliha Nawar from the Bangladesh Sheikh Mujib Medical University, Bangladesh. Okay, yes, please, Dr. Maliha.
Yes, am I audible? Am I audible?
Yeah. Yes, I can hear you. Just go on.
Okay. Thank you, Dr. Pang. Good morning. I'm Dr. Maliha Nawar, resident doctor of Bangladesh Sheikh Mujib Medical University, Dhaka, Bangladesh. Today is a blissful day, and I welcome you all to the 5th virtual training program of rational use of medicine for health professionals in South and Southeast Asia. So I'm very much delighted and grateful to be a part of this training program organized by Kunming Medical University. Through and through, it was such a helpful and thought-provoking session. It has been really invaluable. There's been 8 lectures in 4 days session. The contents of the lecture has an enormous value, and this value we have certainly gained will sustain us greatly. The lecture was so insightful and up-to-date and enlightening that it really gives me a feeling of accomplishment. The whole program contents are so enriched with diverse knowledge all around. I'm looking forward to come and visit someday to have an opportunity to visit Kunming Medical University physically. Today I'm just going to share a little bit of my insight on ocular side effect of common systemic drugs with you all. I need to share the screen for presentation. Thank you. Okay, so let's get started. Ocular side effect of common systemic drugs. Many systemic drugs have reported ocular and visual side effects that impact patient management. It is important to be familiar with the associated side effects, which can be mild and transient or may seriously threaten vision. After a drug a molecule enters the systemic circulation, it can reach ocular tissues through uveal or retinal circulations. Ocular accumulation sites are 3 major ocular accumulation sites. They are cornea, lens, and vitreous. The duration of drug in the eye is prolonged if deposited, increasing chance for toxicity. Photosensitizers. The crystalline lens normally filter most ultraviolet radiation. Ultraviolet radiation can potentially affect the retina in aphakic and pseudophakic patients. Well-known photosensitizers that cause anterior subcapsular lens changes are allopurinol, phenothiazine, aminodarone, and chloroquine. Digoxin, which is a cardiac glycoside used for atrial fibrillation, atrial flutter, and congestive heart failure. Ocular side effects are common with high doses, which are decreased vision to photopsia, xanthopsia, and scotomas. Tetracyclines are minocycline and doxycycline. Ocular side effects are commonly pseudotumor cerebri. All tetracycline agents are photosensitizers. Ethambutol medications used to treat tuberculosis. Ocular side effects are optic neuropathy, retrovalvular neuritis resulting in blurred vision, and loss of red-green vision. Amiodarone, which is benzofuran derivatives used to treat variety of cardiac abnormalities. Ocular side effects are vortex keratopathy, which is corneal, known as corneal verticillata, anterior subcapsular cataract, amiodarone-induced optic neuropathy, which is most severe side effect. Corticosteroid, high doses for more than 2 years can lead to posterior subcapsular and nuclear cataract. Inhaled steroids associated with central serous coagulopathy, macular detachment can occur in susceptible individual. In patients who are steroid responders, oral steroid induces increases in intraocular pressure. Aminoquinolines. Chloroquine and hydrochloroquine are anti-malarial drugs used to treat rheumatoid arthritis, systemic lupus erythematosus, and other collagen diseases. Ocular side effect, corneal lupasitis, decrease in corneal sensation, decreased accommodation, posterior subcapsular cataract, and relative visual field defects. Phenothiazines, thioridazines, and chlorpromazine are psychotropic agents used to manage depression with anxiety and other behavioral conditions. Ocular side effects may include nyctalopia, brown vision, decreased vision, salt-pepper retinopathy leading to widespread loss of retinal pigment epithelium, and choriocapillaries. Tamoxifen citrate, which is non-steroidal anti-estrogen agent, is one of the most effective anti-tumor treatments of metastatic breast carcinoma in postmenopausal women. Causes are crystalline retinopathy, retinal toxicity, macular edema, and impaired visual acuity. Anti-seizure agents are topiramate, also prescribed for migraine headache, syndrome observed, acute myopia, secondary angle closure glaucoma due to anterior chamber shallowing, gabapentin anti-epileptic used also for post-herpetic neuralgia and neuropathic pain. Nystagmus in 8% and diplopia in 6% are seen. Macular edema, optic neuritis, and visual field defects or ocular side effects are seen. Allergy medications, cetirizine and loratadine has weak atropine-like action. Ocular side effects are decreased accommodation, blurred vision, decreased mucoid and lacrimal secretion, can induce mydriasis and provoke intraocular pressure elevation. Large dose can cause facial dyskinesia and blepharospasm. Tamsulosin hydrochloride, selective systemic alpha-1 antagonist used for benign prostatic hyperplasia. Ocular side effect caused intraoperative floppy iris syndrome. Synthetic thyroid agents is levothyroxine. Ocular side effects pseudotumor cerebri in pre and peripuberty hypothyroid children. Anticoagulants, which is warfarin. Ocular side effect cause subconjunctival hemorrhage, retinal hemorrhage, age-related macular degeneration. Antidepressant agents are fluoxetine hydrochloride, which is selective serotonin reuptake inhibitor used to treat depression, obsessive compulsive disorder, bulimia. Sertraline has same indications. Ocular side effect cause mydriasis, photophobia, keratoconjunctivitis sicca, conjunctivitis, diplopia, and ptosis. Radiation for malignancy therapy targets cellular DNA, kills abnormal and normal cells. Ocular side effect, trichosis, epiphora, ectropion. Dry eye in 6 to 1% of patients are observed. Cataract, uveitis, rubiosis iridis, radiation retinopathy, radiation optic neuropathy. To sum up the whole thing, the ocular and visual side effects from a patient's systemic medication can range from mild to severe. These side effects may or may not be serious enough to warrant discontinuing treatment, but recognition of ocular and visual side effects is important for prompt management to prevent and minimize serious complications. Familiarity with medications improves by routinely paying attention to concomitant medication. Thank you. Thank you very much for giving me the opportunity.
Okay, thank you. Thank you very much for Dr. Miha's introduction and where we went for presentation. And thank you very much for your participation for this program. Okay, now let's welcome to